Now we'll move to talking about another classification of what congenital heart diseases. Now for this classification of congenital heart diseases, I just want to discuss the terminologies. If you understand the terminologies, it's very simple. All right. Now as I'm facing this, as like you two are sitting in the front of your screen, all right, so this is your right. Do you understand? So if we're saying this is your left, right to left shunt, what simply means blood is moving from the right to the left side and it's abnormal. Do you understand? So this usually forms a basis of classifying congenital heart diseases, because you want to actually classify them based on what? The direction that blood is moving. So this is what we're saying, that a baby has a problem in their heart and blood is moving from the right to the left. Right to left shunt. Blood is moving from the right to the left. So what are the possible issues that could actually cause this? Now, right to left shunt, they are just a group of cyanotic heart defects where deoxygenated blood, deoxygenated blood is on the left and the right. The left side handles what? Oxygenated blood. So we're saying deoxygenated blood is moving from the right into the left. You get it? So deoxygenated blood bypasses the lungs. It's not going to the lungs to become oxygenated. It's just entering into the left directly. That means your body tissues are receiving both oxygenated blood and deoxygenated blood. You can now start imagining the complications. So the blood bypasses the lungs and systemic circulation. Okay, and enters systemic circulation. This leads to low oxygen levels in the body. Yes, you have oxygenated blood in the left, quite alright. Okay, but it's mixing up with what? Deoxygenated blood. So it's not pure. You get it? So what is left to right shunt? It's just normal, So normally they say that blood flows from the right side of the heart to the lungs for oxygenation. Do you understand? Let me just give you a summary. But if the blood is not flowing to the lungs for oxygenation, it's directly entering the left. You have a mixture of deoxygenated blood and oxygenated blood supplying the tissues. Do you understand? So that's, you can start imagining the complications. So deoxygenated blood, that's oxygen poor blood, is mixing up with oxygenated blood, that's oxygen rich blood. You get it? So you can see here is what? Left to right shunt, but we're talking about right to left shunt. That's why I actually brought this picture, so that you know the difference. Know the difference between right to left shunt and what? Right to left shunt. So common issues that could actually make blood flow from the right side to the left side. We have Tetralogy of Fallot, we have transposition of great arteries, we have tricuspid atresia, we have pulmonary atresia, we have total anomalous pulmonary venous return. Okay, so issues you have there is what? The tissues are not receiving enough oxygen, so the baby's body is becoming bluish, that's cyanosis. The baby is weak, clubbing of fingers, shortness of breath, that's breathlessness, hard murmur. Okay, so how can I be able to diagnose and know the issue? Echocardiograph, chest x-rays, ECG, cardiac MRIs, cardiac catheterization. So treatment, mostly is an anatomical issue. So you use surgery to correct it physically. There are medications like prostaglandins to keep the arterius ductus venosus open. Okay, then oxygen therapies, and supportive care. Okay, so that was it for this method of classifying congenital heart disease.